Mr. President.
Senator Idaho.
Mr. President, I ask unanimous consent to speak for up to 5 minutes prior to the scheduled roll call vote.
Without objection.
Thank you, Mr. President. Also, Mr. President, I have 6 requests for committees to meet during today's session of the Senate. They have the approval of the majority and minority leader.
Duly noted.
Thank you, Mr. President. We've spent a lot of time this week talking about the problems of our healthcare system. Premiums are rising, hospitals are struggling, and out-of-pocket costs are out of control. These problems are not new. And frankly, notwithstanding all of the rhetoric of my colleagues from the other side, the fact is these enhanced premium tax credits that we're debating today, if they were extended or not extended, are not going to change the fact that premiums are skyrocketing. They're skyrocketing because of the failure of our current healthcare system. These problems were used to justify Obamacare in the first place, and Obamacare has progressively made them worse. Americans did not keep their doctors, as was promised under Obamacare. Americans did not keep their insurance plans, and their premiums did not go down. In fact, Obamacare premiums have risen at roughly double the rate of employer-provided health care plans since their inception. Our Democrat colleagues have only had one response to these skyrocketing premiums: more spending, which they claim is going to stop premium increases. In fact, facilitates greater premium increases. Without ever winning a single Republican vote, they created the Obama premium tax credits, expanded them to all Americans, to Americans of all income levels, and then extended that expansion. These credits did not reduce costs and did not reduce premiums. All they did was shift the cost to taxpayers and help insurance companies to continue to hike premiums higher and higher. Democrats know that Obamacare has failed. They themselves have said so on this floor. But with a deadline quickly approaching again, a deadline that was set by my own Democrat colleagues, they say we have no choice but to extend this failed policy one more time on these premium tax credits. This is a policy they could not even make permanent when they controlled the presidency, the Senate, and the House. Even so, their only offer is more spending. They call their plan a clean extension, a 3-year extension of this program with no reforms, costing hardworking families $83 billion, with tens of billions of dollars going to insurance companies and fraudsters, is anything but clean. Twice on this floor this week, Republicans have offered the Democrats a unanimous consent to have a temporary extension of these premium tax credits with needed reforms to address waste and fraud and abuse that is rampant. And twice this week, that's been rejected. The Government Accountability Office recently uncovered how embarrassingly easy it is to game this Obamacare subsidy system, with the Wall Street Journal calling it a mecca for fraud. Even the Washington Post recognized that Obamacare subsidies make it too easy to scam the system. Fortunately, we have another option. Instead of the minority leader's $83 billion extension, which would do absolutely nothing to reduce fraud and would keep driving premiums higher, Senator Cassidy and I have offered a fiscally responsible proposal that will reduce premiums, save taxpayers money, and give Americans control over their health care. Our bill provides pre-funded, patient-driven health savings accounts for Americans enrolled in qualified Obamacare Bronze and catastrophic plans. Importantly, low-income Americans will still receive subsidies for those Obamacare plans through the permanent portion of the premium tax credit system. Americans who choose this option will have both insurance coverage and help paying for their remaining out-of-pocket costs, all without giving insurance companies a reason to enroll them in plans without their knowledge, as has occurred for years. Our bill also fixes an error in the original design of Obamacare by funding the cost-sharing reductions that it mandated, reducing benchmark premiums by 11%. Let me point that out. That piece of our proposal will reduce premiums by 11%. The minority leader's plan is not going to pass. But if just a few of my Democrat colleagues will join us in voting for our bill, we can put this crisis behind us and lay the groundwork for true reforms. For instance, Senator Wyden and I remain intent on getting our bipartisan pharmacy benefit manager reform to the President's desk. We have many other bipartisan agreements on needed health care reforms that we need to move forward on. The choice before us is clear. We can continue with business as usual and extend the same policy that has brought our health care system to the point where every member of this body admits that it's broken. Or we can try something different. We can change the incentives that Obamacare gives insurers to drive premiums higher and put our confidence in Americans to make the best decisions about their own health care. If we fall off the Democrat-created subsidy cliff, it will not be because we did not have a different choice. Thank you, Mr. President. I yield the floor.